So good afternoon, everyone. To formally introduce myself, my name is Alan Guig, he, him, and I'm the Policy and Advocacy Associate with the Silicon Valley Council of Nonprofits here at SVCN. So today is actually a very extra special occasion because I get to welcome all of you to our very first of 2 children and youth nonprofit meet and greets. In today's part of the series, we're actually fortunate enough to be meeting with Jennifer Kelleher Cloyd, which is the new Chief Executive Officer of First 5 of Santa Clara County. In the spirit of meeting and greeting, we absolutely encourage everyone to be on camera if at all possible during this event. And now as well, it wouldn't be a Zoom meeting if we didn't have the opportunity to go over a few important housekeeping items. So going into that, I want to go over today's guidelines. We'd absolutely love to learn who is in the room with us. So please help us out by introducing yourselves in the chat with your name, your pronouns, your title, your organization, and the native land that you reside on. And while folks also go ahead and do that, as a continuing SVCN practice, I actually want to acknowledge that in San Jose, where I am at in downtown today, I am on the unceded lands of the Muwekma Ohlone tribe. Together, let us commit to educating ourselves and advocating for Indigenous peoples, communities neglected and displaced by the US government and other colonial powers across the world. Since people here are tuning in from multiple different areas, I encourage you to learn about what land you are living on by using the website my colleague will share in the chat and share that information along with your introduction. Also, please note that maps we acknowledge may be and can be insufficient and may not fully represent shared spaces, time periods, overlapping territories, and just so much more. We encourage you to learn more by engaging with the local Indigenous-led and serving nonprofits here in your community. For accessibility purposes, we do have the automated closed captioning feature in Zoom activated. And now with this, you do have the ability to move the captions around on your screen to a place that's more convenient, or you can simply just disable the closed captioning feature entirely if you prefer to just not have it up. To do so, please reference the bar at the bottom of your Zoom as pictured on the slide, click on the live transcript on the right-hand side, and then click Hide Subtitles. If you're having any tech or other troubles during this session, please don't hesitate to private message me or any of my SVCN colleagues directly in the chat. We do ask that you please remain on mute throughout the program unless prompted by our speaker to share out. Please use the raise hand function to ask your questions for Jennifer or simply just introduce yourself. And last but not least, we'd absolutely love to take a moment to thank our co-hosts for this amazing nonprofit meet and greet series and for helping really put all of this together for today's programming. For our co-hosts, we have the Behavioral Health Contractors Association, Educare SV, Kids in Common, and Project Safety Net. We absolutely couldn't have done this without them. So please don't hesitate to use those Zoom reactions. One of my favorite things about Zoom meetings, and please show them some amazing heartfelt nonprofit love. And with that, I'll be passing the virtual mic to 2 amazing leaders in the community that you might already very well recognize, but Sean Girth, Executive Director of Educare Silicon Valley, and Wendy Mahaney Gurahu with First 5 Santa Clara County. And with that, take it away.
Thank you so much, Ellen. Wendy and I are excited to be getting to speak on behalf of everyone who partnered to make this great event happen and welcome you here. We know you're all eager to get over to the main event, so I'm going to turn it over to Wendy to just give a few comments and thoughts we have about our field right now before we jump into the Q&A portion of the program. Over to you, Wendy.
Oh, thank you, Sean. We are really excited to have this event today, not only to meet our new CEO at First 5, but also to talk about what's going on in the space of early education, early childcare, TK, mental health, family engagement, community engagement around our children and families. It's kind of a funny place we're in right now. The pandemic has certainly highlighted all of the things that most of us in the field already knew, and it exacerbated it. And I think many people saw that happening when they were having children at home during the pandemic, and that childcare was an issue. It certainly became highlighted. Everyone certainly knows that mental health is really important and going on at all levels from a point of view of staff that have been champions throughout the pandemic, families dealing with multiple priorities, and young children dealing with not having socialization that they were normally used to. The community is another area that we've not been able to connect in this period of time. Being able to be around other families who are learning how to be early parents, early teachers, and early providers of care to their children, and having someone to talk to about it, having a friend, having a grandma, having a community has been missing in the pandemic, and it's showing up in many, many ways. And one of the other, I think, critical things that are going on at all levels in the state and in our region, and certainly in the country, is all staff who work with children and families in one way or another are having difficulty finding staffing in childcare, staffing in social work, staffing in the schools, staffing in nursing for young children at schools, mental health providers. All of these positions, in particular in a high-cost county like Santa Clara County, are affecting our workforce, which is causing some big stress on families and children. Families are enrolling in TK but can't find the after-school childcare. Teachers that were having mental health consultation in their classrooms no longer can because there are no consultation folks to come. The families that were going and having services are waiting on very long wait lines to see what's going on. And then I would last say the safety net has been struck. In particular, all of these organizations have worked on things like diapers and formula. They have worked on making sure that we got out PPE, even to the point of trying to support childcare, in particular family childcare home providers, with stipends and support. All nonprofit agencies and all government agencies really have been working on this, and it has highlighted the great need that is going on in our field. So the good news is it's highlighted what's going on. The difficulty is how we're going to attack it and how we're going to solve it. And that's one of the reasons why we're here today and why we're so excited to have Jennifer. I'm going to hand it over to Kyra, who's going to be our moderator and really take us through this wonderful event. And we really want to welcome everyone. Thank you.
Thank you. Thank you so much for the introduction. I'm Kyra Kazanzis, CEO of Silicon Valley Council of Nonprofits, SVCN. And SVCN, and you can see the whole team kind of represented here. We're all really proud to be able to bring these kind of meet and greet formats with community leaders to our nonprofit community, especially this week in the space of early education and children and youth, which is one of SVCN's 2022 policy priorities. I do want to tell y'all how to ask questions and participate in this event, but first I'm going to take a minute to introduce today's speaker, Jennifer Kelleher Cloyd, and give her a chance to say something to y'all. She is, as we've heard, the CEO of First Five Santa Clara County, and prior to joining First Five, Jennifer served as the Chief Program Officer for the Law Foundation of Silicon Valley, where she expanded the Legal Advocates for Children and Youth program that provided comprehensive and responsive services to children and families in Santa Clara County, In her work on various boards and councils, Jennifer's focused on systems change work that creates client-centered, equitable, and responsive transformation. Jennifer, so happy you can be here and join us today. And I'm going to pass the mic to you for a second and get us started with some opening remarks.
Or marks. Thank you so much, Kyra, and huge thanks to SVCN for putting this event together. It's really awesome to see so many familiar faces and names in the participant list. And for those of you that I haven't met, I'm really looking forward to working with you in this new role. As Kyra mentioned, I come to this role as a 25-year lawyer by trade, and I'm putting my lawyer hat aside. I'm here in this new role, but definitely bringing a lot of my background and experience working both in systems like education, health, child welfare, and also just my work in the policy sector, both locally and at the state level. So really excited about the opportunity that First Five brought after 18 years at the Law Foundation and 25 years serving children and youth in various capacities. I did just want to share a little bit about why First Five, especially after 18 years. And to be honest, the First Five opportunity, when I first heard about it from probably some of you on this call today, You know, I really thought, wow, what a unique opportunity. First Five is this really cool organization that is government and brings some of the resources and funding of government, but also has some of that flexibility and nimbleness that you all have as leaders of nonprofits. And not only does First Five, you know, help fund and support so many of your programs, but also this team was at the forefront of developing so many of our really important initiatives in partnership with you all, both with the government sector and with you all as nonprofits. So I just really felt like what a cool opportunity to kind of jump to next at this, what I like to call the middle part of my career. So I was very excited to be here. Just a little bit about me personally. I have been working in Silicon Valley, like Kyra mentioned, for 18 years now. Have actually never lived in Silicon Valley, so I'm a committed commuter. But the reason is that I do have 2 elementary school and middle school aged daughters who we live in Pleasanton, and I'm married to a high school band teacher. So our house is very loud, as you might imagine, but also he's taught out in the East Bay for years, and I also grew up in the East Bay. So have been a Bay Area native since about 1980. So definitely have been committed to this geography, this sector, and again, all the relationships I've built with you have already been so helpful in this new journey. Before you all ask questions, I do just want to say there may be some questions that I don't have the depth of knowledge or expertise that my team does. And what I want to assure you is if I don't have the answer, I will work with our team and we will get you more answers. I've been here 4 months now and have learned a tremendous amount every day from our team, who are working with you all directly on the ground and with the families that we serve. So just want to make that commitment out front if you all ask me something that I might need to rely on, might need to phone a friend. But I look forward to getting to know you all more, and thank you again to all of you for hosting this event, and I will turn it back over to Kyra.
Thank you, Jennifer. So it's really great to see everyone here. As Alan mentioned, we really encourage everyone to turn on your cameras since this is a meet and greet. So it's a really engaging meet and greet space. And we're also going to encourage you to start queuing up if you have a question for Jennifer. So if you want to see who else is here and see the other faces in attendance and even communicate with them in the chat, which is totally fine, you can switch your view, in case you don't know, after these years in Zoom, to gallery so you can see the attendees. Or if you really, really want to see me and you want to see Jennifer, then you can keep it on, I forget what it's called, but it's something like the spotlight view. I'm sure Alan will correct me if I have it wrong.
Speaker view, yeah.
Thank you, speaker view. Okay, so if you're a nonprofit participant, we're welcome everyone into this space. And so we know we have some government allies and some other folks, but we'd like to prioritize the nonprofit questions. So if you're a nonprofit and you have a question, you can raise your hand now and queue up if you want to ask Jennifer a question. If you want to add questions in the chat, if you're feeling a little shy, that's fine. We will answer all those questions. And when I say we, I mean Jennifer, because she's committed to answering those after the event via email, and we'll send that to everybody. Also, if you want to remember that if you haven't introduced yourself, you can also introduce yourself and say a few words about your organization in the chat. That's fine too. While people are queuing up, and I know there's some people who already asked questions in registration. So if you already asked questions in registration and you want to remember what those are, you can private message Alan, he'll tell you, and we can send that off to you so you can read it out loud. So I'm going to start by warming us up with a couple of questions. The first one, this isn't like the easiest question, but I feel like it's kind of like the most important one right now, is that, you know, we all know that First Five's experiencing some transitions in leadership and staffing, and that's going to be true for a little while, as happens when there's a new CEO. And we're in a like changing environment. We all have experienced that during COVID, and we'll probably be experiencing it for a little while now too. So how are you and your colleagues in the organization been handling these challenges that happen in transition and the opportunities that happen in transition in this change in the organization in the context of a changing environment? Just a little easy one for you.
Yeah, just an entry level one. So absolutely great question, and 100%. First Five's team has been through a significant transition. When you have a long time, very visionary leader like Jolene Smith leave the organization after 20 plus years, it obviously creates a significant amount of change. And you know, there were other really critical transitions that happened along the same time. And yes, certainly challenging for the organization to kind of explore and weather those, but also presenting a pretty unique opportunity for us to pause and take a look first and foremost at internally, what does the organization need to be successful in this next chapter? One of the things that, you know, I have been trying to bring to the organization is some approaches to shared leadership and decision making. And we started, frankly, with looking at our leadership structure. In light of the fact that we had some other longtime leaders transition around the same time, we decided to wait and work directly with our staff through a 13-week voluntary staff engagement process to really identify what we needed in a leadership structure, what were the elements of leadership that were going to make First Five be successful, and what were some of the things that we might want to do and show up differently. So I'm excited to say we did finalize a new leadership structure about a week ago, and we'll be getting ready to post those executive positions shortly, and would love to see some of your faces possibly in the queue for those. But really, we've been spending some time looking internally at what we needed to be successful and to support our staff. I think many of you also know that First Five is in the middle of negotiating our very first collective bargaining agreement. And obviously that takes time and resources starting from scratch as well. But it's going to be really important to make sure that we are caring for our staff in the same way that we ask all of you as partners and funded agencies to care for the communities that we serve. So really have been spending a good amount of time focused internally. There's some big strategic questions on the horizon for First Five that I know we're going to talk about. You know, one being, you know, a significantly declining revenue source that we need to tackle and look at and plan for. But also it's time for our 5-year strategic plan. And I don't think any of us can deny that no one predicted where we would be 5 years ago, both in terms of just early childcare, early learning, families, but obviously emerging from the pandemic as well. So we need to ask ourselves questions about what First Five's role should be, both as a funder, but also as a partner and as a convener, as a trainer. Where should we be on the lines of prevention versus intervention? So we have a lot of strategic questions to tackle. And in the meantime, we need to keep doing the good work that we're doing. You know, we've launched a couple of really big initiatives this year, expanding into the refugee community and a major investment in workforce pathways. As Wendy very articulately shared, the lack of childcare is a huge issue for the community and one that is squarely in First Five's wheelhouse. So, you know, we are still wanting to continue to invest and focus on those programs that are critical while we do a little bit of rebuilding and reassessing. So I think it's fair to say we're definitely in a transition phase, and you may be seeing things a little differently from First Five than you might have in the past. And I would say the global theme is that we're really trying to focus on what we do best, what our role should be, and also the best way we can support you all to best impact the lives of the families that we're all honestly here to serve. So that's sort of how we've been handling the transition.
Yeah, great. I have a follow-up question, but I'm going to go to a couple audience questions. We have one from Monsi Kathuria, and maybe Monsi, can you introduce yourself and your organization, and feel free to ask your question.
Yeah, absolutely. Thank you. So I'm Monsi. I'm the Associate Director of Health and Care Policy at Working Partnerships. So this is actually something I'm also in the middle of working on, is how the childcare landscape is shifting and what that opens up. And so it's a question I wanted to pose for you is, how do you see the rollout of TK transitional kindergarten impacting the current landscape, both especially for families and childcare providers?
Such a great question. And, I think we're all excited about the expansion of options for our youngest children. And there are going to be a lot of challenges in the rollout. And I think one of the biggest challenges that we know we're going to face is what it's probably going to do in terms of further limiting our options in terms of workforce. And one of the things that First Five has been looking at is kind of the equity issues that that's going to face. Obviously, school district jobs are going to have benefits and additional protections, and it's very likely that a number of our childcare providers and preschool teachers will move into some of those positions, leaving a number of our classrooms vacant and a number of our slots unable to be filled because we don't have the workforce there. One of the things we did last week, our team held a really great forum panel with a number of our family childcare home providers. And I think our First Five team really feels like that's where we need to be looking to invest and build capacity. And one of the other ways we're doing that is through developing apprenticeships, so we can have individuals have on-the-job training while completing free college in order to be in those positions to move into those roles where they're going to have a much more equitable income. And the last thing I'll say about just how this is going to impact all of our childcare spaces is we need to be supporting those micro businesses, which are mostly created, and many of them are created by women of color in our community. And running those businesses on top of caring for our children and figuring out how to do enrollment and logistics and insurance and all of the licensing requirements is something that we think we can probably help develop a network of support for those businesses so that they can A, stay open, and B, possibly expand to accommodate more children. Because again, we are concerned that all of this is going to develop sort of a vacuum behind it as all of these TK and pre-K programs expand at the school district, which again is a great thing, but definitely there's some things that we need to think through in terms of how it's going to impact our community, especially in these first few years of implementation. And our early learning team could tell you so much more than that in detail, and that's again some of the things that they're working on.
Great, thank you. We have another question from the audience. Lorene Patterson, I hope I said your name correctly. Feel free to introduce yourself and your organization and ask your question.
Thank you, Kyra. Hi, Jennifer. Hi, everybody. My name is Lauren Patterson. I'm the founder and CEO of Show Up and Love. And our mission is dedicated to empower, support, and be a guiding light for teenage girls challenged with depression and abuse. We're a new nonprofit, so we're based here in Milpitas, California. But my question is how do I partner with First Five, or how can we collaborate to be a resource, like our program to be a resource, because I'm new to this whole nonprofit sector and I'm really trying to partner with others. So I'm just here to be a resource, and I don't know who to connect with because there's a lot of people that just don't respond. So I'm just wondering, how can we connect with your organization?
Yeah, well, such a great question. And also, before I talk about how you can connect with First Five, I'm just going to shout out for SVCN, who is an amazing connector for the nonprofits in the sector. When I was a leader in a nonprofit organization, they were so helpful, and there's so many resources. So definitely, I encourage you to connect with them and all of these networking opportunities. In terms of First Five, we play a number of roles. We do a fair amount of training and professional development, and a lot of those are open to a number of CBOs. So I would definitely encourage you to check out our Community of Learning webpage for various training opportunities that might be available for you or your team. Obviously First Five is focused on young children, but the reality is a number of our young children do also have very young parents. So I think there's also a big network of individuals, both at the school districts as well as, from Planned Parenthood to, and I know you have a new name, and I'm going to forget what it is right now, but Team Success and some other partners out there who, are really doing some great work with our teen communities. And I'm excited to hear that you're really focused on mental health. Obviously, that is a huge crisis facing all of our community, certainly teenagers, but also it's affecting our children and their families as well. So I know there'll be link up opportunities. And then the last thing is, we do have a really, really broad communications program and team here at First Five. So we really do try to promote community opportunities. We sponsor events. You can reach out to us to ask for us to sponsor one of your events or help promote it. And again, we do bring folks together at convenings and trainings. So it's another great way to feel connected with others that are in your community of practice.
Thank you so much.
Thank you. Thanks for the question. Nice to meet you.
Nice to meet you.
So I'm going to take my moderator's privilege, and I've got a couple follow-up questions for you. There were a couple things you alluded to in your answer to the first question. One had to do with First Five's role as a funder, and the other one had to do with equity and racial equity. So, and the first one is, I think we're all kind of like watching the tobacco tax kind of go down and down. And in that context, can you kind of speak to First Five's role as a funder?
Yeah.
What are the organization's priorities in funding? What is a kind of process that you're using to think about what to do in that context? And yeah, where are you at?
Yeah, no, absolutely. The context is that tobacco revenue is declining, which is mainly a good thing, right? We definitely want less smoking and all of that. And many of you are probably also aware of the flavor ban, which is pending, and First Five does support the flavor ban, but that will further decline our revenue source even more quickly. Right now, we're estimating it's like a 3% decrease, and actually our COO is here, so if I get it wrong, she'll put it in the chat. But we definitely are looking at, our reserves are down a significant amount from last year, so we do need to plan as a funder in a sustainable way. So what we're doing this year, and we're actually going to be partnering with SVCN on this effort, as they have been, real experts in terms of helping county design kind of fair and equitable RFP processes and helping develop, bidders conferences and other practices to really bring folks into the fold who might not be, typical funded agencies, or might have felt like the proposal process was too challenging. So we are, really hoping to redo a number of our RFP processes over this next year. We, as many of you know, because many of you are funded by us, we have absolutely, in light of the pandemic and other things, rolled over a lot of our funding sources for what has now been almost 7 years, which certainly is not best practice in terms of, bidding out services to the community, and a number of new agencies have cropped up or developed. So we do want to give, fair opportunity to other organizations that are out there. But we also recognize that we need to do a better job here of partnering with our grantees and our funded agencies on sustainability. First Five has had a lot of success at accessing some additional private funds and fundraising, and I think there could be a real value in us doing that together. So, jointly proposing initiatives to try to help support some of the funding of some of the work that we are funding now. But interestingly, First Five, if you read our mission, it really talks about us being a catalyst. And I think for a number of really good reasons, we have continued to be a sort of permanent funder for a lot of organizations or a lot of programs, and we haven't really sat down together to talk about, what are our options to either build or find new sources. And that's something that we need to do together with our funded agencies. And I do want to just share that, I certainly have the commitment of our internal team, but I think also of our commission that, any changes that we're going to do in funding, we really are committed to giving organizations, a long amount of lead time, transparency, and allow some time for planning, even if that means that, funding for a particular program might decrease, or a certain amount of funds for a type of program or a service, might be decreasing in order to address some of those sustainability issues of the tobacco funding.
Got it. Interesting. Thank you. My other question, then I would just encourage folks, if they have questions, to raise your hand at this point so you can queue up for the next set of audience questions. I'm sure there are questions, but I heard you mention racial justice and equity. This is a thing that's very important to our membership, SVCN, the larger nonprofit ecosystem, and our organization, and really have prioritized that, as many of us have during, and particularly in the last couple of years. I think we'd really just like to hear, like, how committed is First Five, the commission, and you to, centering and advancing racial justice in the organization and the community, lifting up and centering community voices, and really addressing these, like, all the intersectional issues of gender and disability and economics and health and education justice. Another easy question.
Yeah. Well, first, I'm going to say that unequivocally, First Five is committed. Our commission has designated a DEI committee. They have allocated funding for a DEI director. And I want to just say openly that that was truly because of the groundswell within our organization from our staff. Our staff is very, very committed to building out equity within our organization. And we are at the very beginning of this journey. And frankly, we're far behind a number of you. And we really hope to follow in many of your footsteps in terms of the work you all have done, both from how you operate internally, to how you show up, to how you're advocating at the local level, and to how you're diversifying your own staff. So we are at the beginning of the journey, but we are committed to taking it. We do have a DEI director, and I think, like many organizations, we are struggling to figure out exactly what to focus on when there are so many competing priorities that really require us to look at it with equity. We certainly are trying to bring that lens to our funding and looking at why are certain funds sole source versus made more competitive or accessible to other individuals or other organizations. And I just think it's really fair to say First Five has to do a fair amount of work internally in order to be the best partner and funder to you all who frankly are ahead of us in the work. I think it's fair to say that there's been a significant disinvestment across a number of our communities, and First Five has always looked at data, but we haven't always really looked at the disaggregated data and looked at the data looking at race and ethnicity in a way that really might tell a different story in terms of where our investment should be and who we should be partnering with. So I do want to share, as we launch a strategic plan this year, that's one of the things we really want to look at more closely and bring that to kind of the forefront of our decision making. But we're going to need, some support to do that internally. And I do think we have the commitment, but I think it's going to be a journey like many of you have been on and are leading on.
Thank you. All right, Mary Gloner. Mary, introduce yourself, your organization, and you can ask your question.
Wonderful. Thank you for the opportunity. And for those who don't know me, my name is Mary Gloner. I'm this pronoun she, her, CEO of Project Safety Net, which is a community coalition that was founded by the community in North County, specifically Palo Alto, to promote youth well-being, suicide prevention. And while we don't operate in the K through 5, we're a very strong ally because of that family philosophy. So a question to you, Jennifer, is in light of increased conversations, awareness, and policies, not only locally, regionally, nationally, about children's mental health, I'm very interested in learning about your thoughts on integrating and standardizing mental health screening in preschool or pre-K children.
Yeah, well, so I think those of you who are familiar with First Five's work, screening has been sort of a hallmark initiative for this organization, and we've certainly been at the forefront of the universal screening initiative and are continuing to look at ways to roll out additional screening for our youngest. And right now, the focus isn't necessarily in pre-K, but we are trying to build out some integrated developmental screening practices in our health clinics, where families are automatically going for multiple well-child visits over 2 years. So really trying to build in additional screening opportunities there. A short version, Mary, is, well, it's not entirely true, the more screening, the better, because there is such a thing as overly screening, and sometimes that can actually be a little bit problematic. for the most part, I think First Five has really invested in all kinds of new partners to help us with screening. The truth is, I think where the challenge comes in is we have screened a child in needing services, we screened a family in needing services, and we continue to have our workforce challenges cut out for us. So now we've identified the issue, and we don't always have, a place to send the child. So, certainly the Kids Connections Network is great, and have really built up, a number of supportive services, but certainly our schools are going to have additional challenges with that, especially in light of, what kids have experienced in light of, the lack of socialization with COVID. So I'm very excited about the county's initiative to build out wellness centers in a number of the schools. I think that's certainly going to help those young kids that are on school campuses and be a really great resource. It's also, a wellness center service for a 5-year-old is certainly very different than, what a 13 or 14 or 15-year-old needs. So I think sometimes we struggle to integrate kind of the youngest children and their families in terms of mental health needs, because we are really understandably acutely focused on our older youth and our young adults, and rightly so. But I certainly think with some of the state initiatives, some of the additional funding coming down, we at First Five do want to make sure that we continue to remember to build in those resources for our young kids. So certainly, we do support, additional trainings for our childcare providers so that they can help with screening and identify kind of early learning challenges and other behavioral and mental health challenges early on. But obviously something that, we would be a big supporter of.
Great, thank you. Tracy Wingrove, introduce yourself and your organization and ask your question.
Thank you. My name is Tracy Wingrove. I'm the Development Director at the Healthier Kids Foundation, and we provide screenings for school-age children, dental, vision, hearing, but we are also doing some mental health care screenings for 5th and 6th graders, so moving into that space as well. As you all know, we work with some younger children with our with some of our programs, and we also do healthcare education. Jennifer, I was really curious, and I'd be happy to take this offline as well, about something you said earlier about investigating a shared leadership model for your organization. And I was curious if you could share more with us about that, and also if you see that integrating into your DEI efforts.
So I'll answer the last question first. And yes, I do absolutely think you can't leave out the I in DEI, and kind of inclusive leadership practices, I think, are a really important part of that. So really, I think our staff was not only advocating for shared leadership, but also really interested in engaging and coming to the table to figure out how they could contribute to First Five. They are such a committed team, and really kind of the transition in leadership sort of offered a new opportunity for us to have conversations that were open to all staff. So what that looked like in terms of First Five is, we just held a series of conversations that were open to all. Staff could come and go. They didn't have to come to every meeting, and some of the conversations were difficult, and so staff might take a break. But ultimately, we had a dedicated group of almost half of our staff participate in these conversations with us, really exploring sort of what's worked at First Five in the past, what have been some of our challenges, how can shared leadership, how can we have a leadership model that still allows for shared leadership? So one of the things that we ultimately decided is that for our size, we just had too many layers at First Five. So we had sort of unnecessary hierarchy that also put a lot of unnecessary layers between staff and leaders. So really, now that we've made that decision, of course, we need to work together to build up what those practices look like and really bring, our staff to the table in terms of, when we make decisions. So another great example is, we have a staff work group that's really looking at, how do we build this new RFP process? What are some of the practices we need? How do we look at, when we've been sole sourcing contracts versus, when they've gone out for competitive bid? what are some of the criteria we really want to consider. So, we're just really trying to find more opportunities for our staff who, frankly, right now, in terms of our executive leadership at the organization, the three of us that are currently in executive leadership here have all only been at the organization for a year or less. And there's so much great institutional knowledge that we don't want to lose. So it's really important for us to make sure we have those channels and sort of the open door conversation. So, it's one step at a time, and it's been a lot of kind of, building trust in a new transition. But, I'm happy to talk with anyone about it. But also we're hoping to sort of model, again, what we're doing internally with what we're going to also try to be doing with you all externally.
Thank you.
Thank you.
Thank you. I'm going to invite one of our allies to ask a question. It's Charlotte. I hope I get your name right. It's Charlotte Kibel. And introduce yourself and your organization and ask your question.
Great, thank you. I don't want to say I represent the behavioral health department because it's such a big department, but I'm an early childhood mental health consultant, trainer, therapist, and I think I see Roxana, who was part of one of our earlier training academies here. And part of what I have hugely missed, having created a lot of virtual training experiences, is the role of First Five as convening space for people to come together and learn together and to collaborate across systems. And some of this is sort of a post-COVID question about the path to doing more of that. The best processes I think we had historically were when we had people from behavioral health, from family resource centers, from DFCS, from public health, from these multiple systems learning together about infusing relational and developmental thinking, across our systems.
Yeah, well, first, Charlotte, we're going to need you to clone yourself 10 or 20 times, because we need about 100 of you right now. So thank you for coming and asking your question. I do want to share that, obviously, we can't or have not been able to gather in the same way, that we were able to prior to the pandemic. But that being said, our community of learning team is constantly planning and putting together, trainings on a number of kind of the evidence-based practices that we offer out to, a great number of staff and childcare providers and families. So that is still happening. Unfortunately, it's not happening, face-to-face. And I completely agree with you. Just the relationships that you build, across the cohort of a training you can't replicate it online. I think we've done a really good job of creating a lot of great practices to try to do that in some of our, our SEEDS training and our My Teachstone, by building kind of coaching networks and supportive networks. So there are communities of practice so folks can learn from one another and help support each other and build networks, especially in, some of these really isolated fields. I mean, there's no more isolated field than a family home childcare provider. So the kind of the joy of being able to link them together and support each other to learn, but also advocate together has been really exciting. I will say, Charlotte, I do think one of our big strategic questions as we do the strategic plan is, what is First Five's role as a convener? And the reason why I say that is I know that First Five has provided a significant amount of training in a number of curriculum that we've been doing for years. And we certainly are getting some feedback from providers that they're feeling like there might be a saturation, or folks are doing the training for the second or third time. So I do think we want to take the opportunity to look at what's out there, and also recognizing that sometimes, not always, the evidence-based practices don't necessarily infuse or they haven't been normed, at least in communities that look like ours. So we do want to make sure we also can be kind of an innovator in either connecting our partner agencies to seek out the training that they feel like is unique for their staff or community, and also continue to find to find what's out there. What are other people doing across the country, and potentially bring some of that here. But I will say, I think that's going to be a big question that we explore in our strategic plan, and we really are going to want to hear from the community about what they want, because we are starting to hear that maybe some of the trainings, folks, there isn't as much of a community need for that, and so those are investments that we could be putting into potentially other things. So we do really want to hear from not only families but also kind of providers as to what are they really looking for to continue to develop.
Thank you. All right, Dana Bunnett, please introduce yourself, your organization, and ask your question.
Sure. Hello, I'm Dana Bunnett, Executive Director of Kids in Commons. So nice to see you, Jennifer. And my pronouns are she, her. And my question is, you addressed this a little bit in the equity question, but I wanted to have you elaborate a little bit on community, how communities can be really engaged in policy and programming, and in the spirit of nothing about us without us.
Absolutely, absolutely. So again, I'm going to start by being really honest and say I think First Five absolutely has a commitment to this, and we are still really learning how to do it. And again, many of you are really, experts at engaging with the community, and in many ways serve as that voice. But we have talked quite a bit as a team about wanting to have deeper and more direct engagement with the families that are impacted by the services that we fund or provide. So, certainly, I think we've all been a part of various engagement efforts that, have not been successful. It's sort of the same. We're asking the same three young people, or the same four parents, questions about what the community needs. So certainly we need to engage in a different way, and we need to be going to the tables of the community and not trying to create new tables for community to join us at. I think we've learned over time that doesn't work, and certainly we need to figure out a way to compensate our community for their time and their expertise in a way that I think we struggle with. As First Five is also a government entity, and we have some similar challenges and bureaucratic structures that make that difficult, but difficult is not impossible. And I really appreciate kind of the journey that I think our county, our city, and a lot of our nonprofits have been doing together to figure out a true way to compensate folks for their expertise that we desperately need. And so I think there's a lot of innovative strategies out there. I think we really have to think about how First Five can do that well as we walk into our strategic planning process. We have certainly been doing some deeper work with a couple of communities over the last couple of years, and that work has been really rewarding and really hard and challenging. And we have definitely found that, again, the bureaucracies and how community wants to mobilize don't always work well. So I think to figure out a process that is both meaningful and values community, but also asks community that is not typically asked. It might take door to door. We might not be able to hold a 3-hour convening and say we got it all. And so I think it's going to take some time and some real investment of individual time to build the relationships before we ask the questions. And that's sort of what we've learned through some of our work with more deeply with particular communities. It's taken, our team invested, weekly meetings for months, really before I think the community was willing to trust us with, honest feedback about our work. And especially when we say, hey, how are we doing? It's not easy for them to say, well, you're doing this poorly, you're not doing this well. So, we have to also figure out a way to create that space. I don't want to say a safe space because I think we all know that that's probably a misnomer. But I'm hopeful that on this journey, with at least our strategic plan as a starting point, we can find a way to do that. And frankly, you all are our community too. As a funder, as an agency that doesn't necessarily do direct service in the same way that you do, you really do serve as a voice for community as well. And I don't want to devalue that by saying that, we also want to hear directly from community, because I think that's really important for you all to know.
All right, thank you. I feel like we have time for like 1 or 2 questions. I think I'm going to take one of them, And so if anyone has another question, I know I see one in the chat, which I can ask. And then if there's someone else who wants to raise their hand, that'll probably be what we have time for. I'm going to ask another like softball question, LOL. So, you know, all of us as nonprofits, we've been experiencing staffing challenges, hiring challenges, and obviously this is a major issue in the in childcare and early education. Do you have any thoughts at this point about how First Five is going to show up with that issue, and how will you plan to address these really severe staffing shortages?
Yes, actually, that is a softball, in part because you know, our team here at First Five was really hard at work on that issue before I arrived. So you know, we do have some pretty exciting irons in the fire, some of which I've already mentioned, but you know, we are really pumped to launch our apprenticeship program, and we were just at EduCare a few weeks ago, and we'll be again, I think, in another week, to really bring in some folks into the childcare field that will, you know, bring them in at that associate teacher level, definitely more of a livable, accessible wage. And, you know, again, bringing people in, investing in what it takes to get them through the apprenticeship program, including support. And it's a huge partnership with so many of you that are here in terms of employers being willing to bring on apprenticeships and handle the issue of, you know, it doesn't necessarily meet the ratio. So we really are appreciative of this entire sector effort to kind of bring more folks into the field. I think the Shared Services Alliance, which I mentioned earlier, is really going to help keep some of our childcare homes especially open when, you know, many of them are struggling. And I think hopefully it might allow some of them to expand. And this is on top of a lot of the work our teams are already doing to support and provide professional development to those that are in the field. And that's with a great partnership with the County Office of Ed, who has been, you know, really standing right next to us on this front. And then I think the other thing is really kind of looking and taking head on this equity issue of the TK pre-K expansion. And really, we're going to need to do some strong policy advocacy to try to get those wages to be competitive, to keep people in this field. And what I'm excited about is actually that the panel that our team put together last week, you know, really there are some amazing advocates that are providers that they don't need First Five to speak for them. They are very prepared to speak for themselves and ask for what they're hoping to see in this development. And they are so excited and also feeling a little bit left out of the development. And that's really a resource that we cannot afford to not nurture and support in terms of the entire continuum of you know, having kids in high quality care. I think the other just obvious issue here in Silicon Valley is, you know, using the federal you know, poverty guidelines for anything here is just laughable. So, you know, it's really hard to see, you know, childcare slots that we, you know, are empty because our income requirements are so exorbitant. So I think looking at, you know, I think what many of you call the gap families in terms of finding, you know, affordable and accessible preschool for that group is going to be really important. But that's what our team's working on, and with huge support from the county in terms of funding it. They've funded that work for the next 2 years at a $5 million investment. So, you know, this is definitely a major focus of our programming over the next couple of years.
All right, this one needs to be a quick one. I think this is our last question. It comes in the chat from Mindy at Planned Parenthood Marmonte. And it is, what's the future like for supply programs at the FRCs, like the diapers, wipes, period supplies, and formula?
Yeah, so we are continuing to distribute materials, although I will say there is some distinction between what's available through FRCs in the city of San Jose versus the larger county. And that's just unfortunately due to you know, recovery funds being used in a particular way. But we do continue to have all of those materials available for distribution. So hopefully families are still accessing them. We've seen formula go down, which was interesting. So, you know, definitely if you have families that you're working with that need materials, they should still be able to access everything but formula at almost all of our FRCs. And I know I have lots of FRC folks here, so if I said something incorrect, I'm looking at, I see some folks from Sherman Oaks and some other ones. So please let me know if I have that wrong. But we do still have resources available for families. And Supply Bank has been an amazing partner on that effort.
Jennifer, thank you so much for being here today and sharing more about your background and your priorities for First Five and what First Five is up to. Everybody, if you could please show your nonprofit appreciation with Zoom reactions and messages through the chat for Jennifer. Thanks also to our amazing co-hosts, Behavioral Health Contractors Association, Kids in Common, Educare, and Project Safety Net for helping put together this children and youth nonprofit meet and greet series. And lastly, as a nonprofit association, we want to be accessible to you all as best as possible. So please check out the information listed here on this slide to how to contact our team. Your feedback and suggestions for everything we do really helps us improve the way we serve this sector. Later this year, we'll be doing our big nonprofit survey as another way we find this thing out, but you can always just email us. Thanks for joining us today, and we hope to see you at a future event.